Morning, everyone. I was asked to step in at the last minute. I don't mind, it was quite a shock, but okay, I'm here. I'm going to share my very personal story first of how I became a midwife. And it actually started 14 years ago, after the birth of my first daughter. At 16, I fell pregnant, and in those days, it was a sort of a taboo subject. You were often the only girl, and I was sent to my grandmother, where I spent most of the day in the bedroom. I wasn't allowed to go outside because it was shameful, and I had a lot of time to reflect and sit and think. And on clinic appointments, I would go to the MOU, which was around the corner from my grandmother's house, attend clinic, and having to face these midwives who sort of looked down on you, made comments about your age, and they basically scared me. I wasn't prepared for birthing. I had no idea what I'm going to go through. All I heard was stories from my aunts, my grandmother, and the midwives, thinking that I wouldn't be able to do it. As my labor day approached, I was so terrified. I'd sit up at night and just think, why? Why did this happen? I don't want the baby, all those thoughts. And baby moving around inside of you, it's supposed to be a beautiful time, and all I could think of was just being sad all the time. During my labor pain started, and I wasn't sure, and I just kept quiet, and my sister was actually the one who woke up and said, "What's going on with you? You're wiggling around like a worm." And I said, "Well, I don't know what this is, but I think it's that." I went to the MOU, and I was very abruptly put onto a bed, open your legs, checked, and I was 1 centimeter. I had no idea what 1 centimeter meant at that time. And they told me, "Oh, well, go home and come back when it's worse." And I thought, but it is worse. I was going through so many emotions, just the memory of it was terrifying. I went back, and they told me after 3 hours, I'm 1.5 centimeters. And I thought to myself, but when is this going to end? And eventually I was 5 centimeters, and they kept me there. I said, "Oh, well, 5, okay." I was too scared to ask anybody, how many centimeters do you have to get to before the baby comes out? I was put onto a bed and basically left alone, curtains closed, and I remember people hustling and bustling by, midwives, patients screaming somewhere in the distance, and nobody came. I think it was about twice somebody came and just checked, and nothing was happening, and left. Nobody spoke to me. I wasn't allowed to have a birth partner. I wasn't allowed to have water, because I asked for water, and they said, "No, you can't have, you will vomit." I said, "Okay, fine." Spent the day in pain. I think I labored 14 hours. And eventually I felt like I need to poo. And I was so afraid to call someone. I just sort of squatted around the bed. And I felt so embarrassed, because I thought, what if something comes out? Because it felt like a number 2. By the way, a midwife passed and saw me squatting. I was scolded, put back onto the bed, and she did a vaginal examination, and she just said, "Come with me." I could barely walk, and she took me to the labor room, and she said, "Okay, it's happening now." I was told to push and push and push. Nothing was happening. And then I just saw a scissor come past, and I was cut. No infiltration, nothing. I could actually feel it. After a few pushes, the baby came out. And at that moment, after being basically left alone, not knowing what's happening, I had a moment of just being in awe and staring at this little baby that has just come out of me. And despite having a bad experience, something just happened inside of me. I fell in love with this little baby, with this little girl, and after 6 hours we went home. Nobody told me anything about breastfeeding. My experience at home with my baby was baby crying, I'm crying, people telling me, but you don't have milk. I had developed mastitis. It was a whole horror story. And my baby was formula fed then after that. But what the experience left me with was the feeling that I had in me that somehow there's a different way. There must be another way to do this. I sort of fell in love with the whole birthing story, and it stayed with me. At that time, I wasn't allowed to go back to school according to the education system. And I stayed at home with my daughter. And then when she was about 2.5 years old, I went and applied for night school. And then one of the educators looked at me and said, Candice, you are actually young enough to go to day school. And I think that would be better because night school tends to take a bit longer. And I looked at him and I thought, no, why would I go to day school? Because I still had that sort of fear in me that people look down on you because you had a baby. And he refused to sign me up for night school, and he told me, go to day school. And I can't remember his name, but I think I will forever be grateful to him for actually forcing me to go back to day school. My parents were very supportive. My mother told me, well, put on a brave face and go back. It's either this or nothing at all. I went back to day school, completed grade 11, and I was selected to then write an exam for bursary for Stellenbosch University. And of course, I applied, and I got the bursary and applied for nursing because I wanted to be the person who delivers a baby and who spends time with a woman in labor. That is how I became a midwife. I went to nursing school and I did everything. I couldn't wait to get to the delivering part. That was, for me, the only reason why I did nursing. But I enjoyed every aspect of my training. I then went on to work at Mowbray Maternity Hospital in my community service here. And being exposed, hospital only, I've never done independent midwifery. We are exposed to only high-risk pregnancies, so nursing high-risk mothers, it's quite draining emotionally because you are also faced with a lot of sadness, with pregnancy loss and, just bad outcomes. But at most times, it's so rewarding to be able to help someone, and some of these mothers, coming from where I come from, you have no idea, you have no understanding of what is happening to you. And I sort of got a reputation in the labor ward with being able to work well with the teen mothers that we have so many of today. Because some teenagers are very uncooperative, they're very defensive, they don't want anyone to touch them. And I don't know if you can call it a teenager whisperer or something. I just somehow got through to them. And I think it's because of people sort of looking down on them, and they're always hearing that, this is bad and this is a bad thing that you did. So they come into labor with that defensive attitude and you're not going to touch me. And it's just basically trying to get through to them and just being gentle and calm, and then they respond to that. So for me, being a midwife, what is a midwife? It's someone who spends time with a woman in labor and she knows the patient. I know we don't spend most of our antenatal, if you're working in labor or in a hospital setting, you're only there, and it's difficult to sort of not make it look like it's a conveyor belt because it's so busy. You want to get sort of the magic, you want to keep the magic of labor there, the magic of birthing a baby. And sometimes it's lost, a lot of times it's lost, especially the setting that I come from. So you're trying to keep it there and just keep it alive. And at most days, it's chaotic. It's quite chaotic, and it's just at those days when you need to take a breath and think, okay, here we go, let's do this. Some days you feel like taking your bag, running, screaming, and crying out of there. But you do it, and you get through it. So, by definition, they say a midwife is trained to assist women in childbirth. I think she's a bit more than just a trained birthing attendant. She's someone who takes her knowledge and skills that she's learned in midwifery and she practices it, but also there's an emotional aspect that you have and you really connect with your patient. My memories of my birth is the midwife's eyes. Her eyes kept pouring into me and telling me to push. She actually made eye contact with me. So that is what has stayed with me, and I always try to do that. Make eye contact with your patient. At times it's very difficult to get a relationship going with your patient when you're so busy in the labor ward. But when you maintain eye contact during that crucial time when the baby needs to come, it changes everything. What I want to leave you with is that there are certain aspects that sort of threatens midwifery today because of obstetricians and doctors who have sort of taken the forefront with in private practice and women tending to choose them more often than not, choosing a midwife. In my setting, midwives work long hours, often under tremendous pressures, with high patient loads, shortages of staff, and poor working conditions. And the staff morale is very low. Midwives are often undermined and not respected by medical professionals. Not by all of them, but there are days when you feel like, what am I actually doing here? The expertise is often disregarded. Your ideas are just frowned upon. You know, when you say, I think this would be best for this patient, because you know this patient. And because of that, many midwives become despondent, and some just give up. They just say, I don't want to do this. I think I'm done. And it's often the young midwives that come in. They work the community service here, and then they're done. They're done, and they want to leave. After the year, they're gone. What I do is I mentor them. I do clinical facilitation with them, and you nurture a young midwife. And then she will eventually develop a love for it. And in that way, we can retain more of our young midwives and keep it going. It's our professional duty to pass on our knowledge and skills to other midwives. Thank you.